I'm Dr. Joseph Mazzola from Iredell Health System. Wanted to come to you with a quick message and an update about COVID-19. As we are hearing in North Carolina and in our own community, the number of cases are rising. But our message to you today is very simple. Wear a mask. Mask up. Thank you. Dr. Elnaggar, as a pulmonologist within our community, what are you seeing happening with COVID-19 and the pandemic?
What's going on now is a bit concerning to us physicians and to everyone else in the community, actually. The virus was first basically announced back in March. At that time, we expected, of course, that would be overrun with cases, shorter ventilators. What's happening, actually, what we predicted back then is going on now. We have a very wide base of cases in the community that can spread more viruses and get more people sicker and basically flood the hospital with cases.
One other question, Dr. Elnaggar. You mentioned that the hospitals are getting full. Patients still should come to the hospital if they're sick, correct?
This is a key point. You don't want to wait too long because time is an essence. Once a person gets sick, especially with fever, shortness of breath, relentless cough, the longer you wait, the sicker you will be. And the chance of you being sicker and sicker is much, much worse. So time is very, very important. If you have symptoms of high fever, shortness of breath and cough, do not be stubborn and try to stay at home. Get help as soon as you can. As I said, the hospitals now are filled more than ever with cases of COVID-19. They are very sick patients. They are very labor intense, demanding. Some of them are so sick that we can no longer help. So the time now is more than ever is to be more careful, practice social distancing, wear the mask outside. And if you know someone who has the virus, you need to stay home for at least 10 days, as the CDC recommend recently to everyone. Just be more careful. Just prayers, we need that, and make sure you keep your mask on, because this is the time to be very, very careful, because the virus basically is going haywire, for the lack of a better term. Keep your mask on, please, everywhere you go.